finally, let me assure all Nigerians that we shall not relent, we shall not retreat, we shall not surrender until we overcome all barriers to safe motherhood and healthy childhood.
These were the words of the Executive Director of the National Primary Healthcare Development Agency, Dr. Shuaib Faisal, on Monday in Abuja, in a moving and thought-provoking categorical statement, while declaring a state of emergency on maternal and child mortality, and also the presentation of the agency's strategic approach to rapidly reduce such mortality at the primary healthcare and community levels. Every day in Nigeria, approximately 145 women of childbearing age between the ages of 15 and 45 die from preventable causes related to pregnancy and childbirth. For a candid and better understanding, the Executive Director of the NPHCDA went a little further to liken it to having one Boeing 737-300 series airplane fully loaded with 145 women crashing every single day in Nigeria and killing everyone on board. Isn't that sad and scary? Little wonder why the National Primary Healthcare Development Agency is declaring a state of emergency on maternal and child mortality in Nigeria.
I hereby declare a state of public health concern on maternal, newborn, and child deaths occurring at the primary healthcare and community levels, and a decision to establish a national coordination center within NPHCDA to provide oversight on RMN-CAH+N activities at the primary healthcare level. This center shall be called the National Emergency Maternal and Child Health Intervention Center, NEMCHIC.
He added that the center will work with the National Polio Emergency Operations Center to see that this becomes reality.
This center will work with the National Polio Emergency Operations Center and transit polio resources towards RMN-CAH+N interventions. We will use the same structures to overcome this poor data, working with our traditional institutions the way we've been able to take control of the polio epidemic. Similarly, in the states where polio EOCs exist, there will be a seamless transition to these state emergency coordination centers. Where polio EOCs do not exist, we shall work with our state primary healthcare boards to immediately establish state emergency maternal and child health intervention centers, SEMCHICs. So what shall we do differently? We commit to urgently take action to provide leadership to rapidly reverse maternal, newborn, and child deaths by half by 2021 through interventions that target the primary healthcare and community levels. The truth is that in Western countries, for example, when a woman announces that she is pregnant, people immediately ask, what is the baby's gender? On the contrary, in Nigeria, we immediately wish and pray for the safe delivery by the woman. In so doing, we expose our heartfelt recognition of the reality that she is embarking on a dangerous journey. Royal fathers, distinguished ladies and gentlemen, we are outraged by these statistics. It is notable that these deaths do not make daily headlines in the press, nor raise the same emotions as plane crashes, including the recent air mishap involving Ethiopian Airlines. This is probably because these deaths are among the poor, most vulnerable and voiceless in our communities. What we are saying is enough is enough. And in the three major Nigerian languages, Otoge, Ozugo, Ya Isa.
The NPHCDA is also in a collaborative effort with traditional rulers and development partners to fight this menace in the health sector.
A lot is being done in the area, but I think we need to step it up. And one way of stepping it up is what the ED identified today. As traditional leaders of northern Nigeria, we've engaged in this effort for quite some time. In 2017, precisely, we started what we called our community surveillance and monitoring of maternal and child deaths, which is what we're talking about today. We published our first findings at the end of 2017, and are publishing our second findings in a few weeks, inshallah. I don't know from what point you missed me, but I was saying as traditional leaders of northern Nigeria, we are saddened by the statistics. And working with our development partners and the National Primary Healthcare Agency have started taking steps since 2017 to really bring forth images, names, and addresses of all these mortalities in our communities, so that we can, instead of just giving figures, show real people to our political leaders and to the entire communities, with provision and sensitization and information on where to go to get assistance so that these bad indices, these bad statistics can be curbed.
How many deaths will it take to be known that too many of our mothers and children have died? Childbirth should be a very pleasant experience for the mothers and a happy occasion for the family and the nation. But when we have to say prayers instead, as though the mothers are being condemned, it is time we take action.
And with the ED and the NPHCDA team towards accelerating progress for reduction of maternal newborn child health deaths, but also importantly improving the overall health and well-being outcomes. And we note the declaration of concern today, the clear definition of actions using data, and ensuring accountability at all levels. These are critical steps towards supporting the shift that Nigeria is wanting to do and will see in the years to come. We stand in full support and commitment with the government, with the Federal Ministry of Health, with the National Primary Healthcare Development Agency, all stakeholders and partners. And I believe, and I hope we all believe, and are confident that with this renewed drive and focus and commitment, we will shift the needle. We will accelerate progress, and we will reverse the trend in Nigeria for our mothers and babies and children.
This forum comes on the sidelines of the World Health Day, commemorated every year on the 7th of April. The theme this year is universal health coverage, everyone, everywhere, every time. Everyone, no matter who they are, where they live, and no matter where they need it, should access essential quality health services without facing financial hardship. This includes women and children. We as WHO affirm our commitment to support government in reduction of maternal and child health, maternal and child mortality in line with universal health coverage and the global reproductive, maternal, newborn, child and adolescent health and nutrition strategy. It's indeed time to do more. It's time to act. We owe it to the women and children of Nigeria. Please be assured of our full support, ED and stakeholders.
It is different from other initiatives that we have had, and that is what makes it particularly very important for us in UNFPA. Before, we are focused on policies, strategies, plans, but this, unlike plans, is something operational. We are moving from policy to practice. It is on the practice that we change things. UNFPA has 3 transformative goals by 2030. The first is to end preventable maternal deaths globally, including Nigeria. The second is to end unmet need for family planning globally, including Nigeria. And the last is to end gender-based violence globally, including Nigeria. This is as ambitious as what the ED of National Primary Healthcare Development Goals stated, that in 2 years, 2.5 years, they intend to reduce maternal mortality by half. And to achieve the sustainable development goals, we have to be ambitious, because the goals themselves are ambitious. And congratulations, ED, for that target, which is high up there. We need to have high targets. So I will end by reiterating on behalf of my colleagues from UNFPA's support to the federal government and to the National Primary Health Development Agency to ensure that this initiative succeeds.
Among other things that the National Primary Healthcare Development Agency is doing to raise a sense of accountability is the provision of toll-free numbers for Nigerians to call on every death of any woman related to childbirth.
For every death of any woman that is related to childbirth, we will provide toll-free numbers for Nigerians to call. We will take steps to investigate such deaths and respond within the ambit of the law in order to raise the sense of accountability for such preventable deaths. Using information from our investigations, we will raise awareness on such deaths that occur daily in Nigeria and catalyze an improved sense of responsibility for action among stakeholders, including politicians, public servants, traditional and religious leaders, the private sector, partners, the academia, media, civil society organizations, and citizens. We need to break the culture of silence over these preventable deaths. From the foregoing, it is unconscionable for any of us to go to bed each night without a sense of urgency to reverse this trend, given our knowledge that these deaths are occurring among our mothers, our aunties, children, relatives, neighbors, community members, and citizens.
Stakeholders, development partners, the media, and health enthusiasts in the fight against maternal and child mortality in Nigeria hope that there will be a drastic reduction of maternal and child mortality in Nigeria with the establishment and the introduction of NEMCHIC, that is the National Emergency Maternal and Child Health Intervention Center. Once the toll-free numbers are given, you and I will have a responsibility to join as agents of change in the sector. Toyin Ajolore, reporting for On Duty TV, Abuja, Nigeria.